Hi everybody, Kim Marshall here. It is Thursday, August 27th, and it's time for another Leader Livecast. I'm your host. I'm the co-founder of Swell Public Relations, and also the host of the Global Wellness Summit podcast. So just a little plug here. We've just launched today our next season of 7 podcast episodes, and the difference between those two is that the podcast is wide-ranging, and these Leader Livecasts are about coping with COVID. But let me join now Dr. Chapman. This is our guest today, and let's make sure that we try to go live with him. He is a licensed clinical psychologist and an anxiety expert. Don't we need that? Dr. Chapman, how are you?
Hey, hey Kim, good to see you.
So good to see you again. We met
Likewise.
We met via Omrit Ocean Resort and Residences in Palm Beach because you advised them. You're their anxiety and psychologist advisor. And the last time we talked was for Global Wellness Day, right?
Yep, that is the last time we spoke.
Yeah, and we can always depend on you for specific, clear advice, Dr. Chapman, so I thank you for that. Can we start out by explaining your background, how you got into psychology?
Yeah, so Kim, the short version is that when I was an undergrad at Center College, a small liberal arts school in Kentucky, in the middle of nowhere, I went into my first psychology course, and I didn't know anything about what psychology was. I really didn't. But it sounded interesting because it was kind of a gen ed. And when I took my first semester of psychology, which is rare, as you know, I was like, oh, this is what I want to be. So when I delved into psychology and then got, of course, matriculated to say abnormal psychology, I said, okay, so anxiety disorders are one of the most common things people have. A third of people get treatment, yet it's treatable. Yeah, sign me up. So once I learned that as an undergraduate, I immediately fell in love with psychology.
And how does being an athlete tie into that? Can I call you Kevin, please? Because
Absolutely. Yeah, yeah, of course.
I'm very bad at titles. So, Kevin, tell us
Yep.
about how being an athlete helped with this.
Yeah, so as you know, Kim, I was a two-sport athlete. I played football and ran track in college. I was a sprinter. And as you learn as an athlete to engage in what we call mental toughness. So you have to regulate and manage a wide range of emotions as an athlete, and you have to do so in a way that, is very controlled and present focused. So ultimately, we know that performance anxiety, for instance, is something that we all have that's not just specific to athletes, but also in any sort of form, whether it be giving a speech or meeting someone new for the first time, ordering food, the things we take for granted. And being an athlete, that's really important because ultimately we all have to deal with anxiety, and that's not something that's exempt in a sport, right? So it's something that we all have to navigate. It's a normal process, and it's something that we all have to deal with.
Well, how long did it take you to get to your specialty? How long did it take you to hang a sign on the door, Dr. Chapman, that this is what you were and how you could help people?
Yeah, so ultimately, I have a PhD in clinical psychology and I have a second expertise, I guess, if you will, in sports psych as well. So ultimately, from, going through my undergraduate degree, my 4-year program of that, I then did a clinical psychology master's degree, which was about a year and a half, 2 years. And then I went into a PhD program and much of my coursework transferred at that point. So at that stage, Kim, when I transferred from a master's program to a doctorate program, I worked with a specific professor as a mentor who specialized in what we call the family transmission of anxiety. So that was an additional 3 years to
Wow.
do that, yeah, to do that coursework. And that's when I started getting my basis for anxiety related work.
Well, all I can tell is every time I talk to you, I feel less anxious. So I'm happy to hear that. Now,
Good.
Kevin, this is such a weird time. This pandemic hit. If that isn't cause enough, then you have racial unrest. And now we have a political election year with yin and yang, what some people feel is inciting division. And it's enough to give anybody acid reflux. So
Hmm.
tell us how you started seeing patients. How was this year when the pandemic hit? How is it different for you?
Yeah, that's an interesting question, Kim. As you know, I do quite a bit of media psychology, and I've spoken with a plethora of journalists since COVID. And one of the things that I predicted, which is not that I have this ability to do that, it's just more so how anxiety disorders work, is that what I've been telling journalists from the outset is that what we can expect is that the incidences of anxiety and related disorders, because of the uncertainty associated with things like COVID and the racial injustices combined, two pandemics, if you will, you're going to see an influx in cases of anxiety, which 40 million Americans a year have anyway. So you take something that triggers a great deal of uncertainty in anyone, right? That's obviously going to create an opportunity, if you will, to experience more anxiety symptoms. And of course, that came into fruition. So our phones, of course, have rung off the hook as a result, because it takes the right situation or relative stressor, Kim, to trigger anxiety and related symptoms for people who have a predisposition to begin with. And COVID is like literally the stars aligning in a very negative way for people who have a predisposition to be anxious to begin with. Add that uncertainty with COVID, add physical distancing, taking away your ability to work out, see loved ones, so on and so forth. That's
Yeah,
going to create anxiety in anybody.
right, exactly. The other thing that I just saw on your Instagram feed is you were quoted in a Wall Street Journal piece that was, maybe a ray of hope that more of the Black population are feeling open to seek out therapy. I think it was a National Institutes of Health 2017 survey said 48% of white respondents would seek help, but only 31% of Black respondents would seek help. So what are you seeing there?
Well, what I'm seeing now, well, historically, there's been a stigma associated with mental health in general. And then when you talk about people of color in general, then you get even more specific in terms of the disparity of mental health. And then when you talk about African Americans in particular, then you see even more of a distrust of mental health services, mistreatment historically with the medical profession. Historically, so culturally speaking, many African Americans have developed what we call healthy paranoia, because we don't know if someone is going to take advantage of us in a mental health arena or a health arena at that matter. So with that said, as things have evolved over time, though, when you have more people that look like me, other persons of color who are mental health professionals who build cultural trust and so on and so forth, you're naturally going to be able to decrease stigma and say, look, we all have batteries that need to be recharged. And it is important for us to learn how to regulate emotions despite whether or not we have actual, what I call, Kim, true alarms, which are actual racial injustices, actual discrimination, actual macroaggressions. Like those things really do happen. But with that said, we still have the ability to meet someone that we can match with culturally to help us navigate strong emotional experiences. And I think you're seeing an increase, thankfully, you're seeing an increase in people, particularly African Americans and other people of color and indigenous populations, who are increasingly seeking mental health services because the stigma is becoming less and less. And that's an awesome thing.
That's great. But also, did I read somewhere where only 4% of professional psychologists are Black? Did I read that right?
You read that correctly. And then if you break down gender discrepancies there, then if you think about how many of those are actually African American males, that number is even lower. So yeah, 4%. You're talking 2% of the population roughly with a doctorate, and then when you start getting into psychology, the numbers even shrink even more. So yeah, absolutely.
Well, we hope we can inspire listeners. I just feel, I've been talking about this a lot. We interviewed a wellness counselor from Toronto, a beautiful Black woman, and she was saying that Canada allocated $10 million for Black mental health. But I just feel like unless we've been through it and firsthand, I was explaining that I was invited by a dear friend who's a wellness coach and a journal. She teaches journal writing, and she's Black. And she invited me to one of her classes. Well, everyone on the Zoom call was Black except one other woman and me. And I knew most of them, and I thought, well, they're, fine, upstanding citizens. They're so well respected. How would they ever run into a problem? And they were bawling so hard on the call that they had to turn their camera off. So to see how, first it's the George Floyd video, and now it's Wisconsin.
Yep.
How do you tell people to absorb the news? What are you doing with that?
Yeah, that's as you know, it's a loaded / great question, Kim. And then I had to remind you, I'm born and raised in Louisville, Kentucky. That's the home of Breonna Taylor. So then we have that in my own backyard, and the things that we've had to deal with here in Louisville, my city, right? My city of birth and where I was raised. So then we have that right here, like literally directly outside of my office, so to speak. So with that being said, I think that on the one hand, it's important to recognize that racial injustices are real. Um, and I think that what we know and what's really important is that what African American folks need right now is more so allies like you, people who don't try to speak to saying, well, I know your experience, or here's what I think you should do. The more important concept that we need right now is not self-pity. It's not, oh, I feel so bad for you. It's not that. It's, I need people to be able to say, tell me about your experience. Let me understand the best I can without having lived through it myself personally. Tell me how I can be of assistance. How can I sing on a rooftop on your behalf and join a cause? And the irony of that, Kim, is that that also helps regulate emotions. When you see injustices, racial injustices, and other things, that's another way of you saying, if my anger is triggered or my sadness is triggered, those emotions are trying to tell us to attend to something in our environment that's off. And that's very important for us people globally to be able to come together and unify and be able to eradicate that sort of thing.
And something hit me yesterday that is so shocking. Like you say white privilege, right? A lot of people like to say white privilege. Well, there's a split in the white privilege circle too.
Mm-hmm.
I don't know
Yeah,
how privileged I am, but I'm very fortunate.
right.
I was talking with a girlfriend last night who I know has different social thoughts than I do. It's because of who she hangs around, the media she consumes. But we do okay because I think we should love each other, and differences are beautiful things. Until she started saying things that were so not factual or scientific or even reasonable that I just popped. I was like, what? Like, you think wearing a face mask takes your personal freedom? Did you wear your seatbelt here when you drove here? And then you go home and you can't stop, right? So I woke up at 3. I'm like, ah. So how do we deal with approaching our fellow human when our, anxiety causing divisions can be what's on the table?
That's a terrific question, Kim. And I think that at the end of the day, it still boils down to having what we call cultural humility. And I think that that's so incredibly important, is this idea of being humble culturally. Now, that doesn't necessarily mean that you're wrong, right? It doesn't mean that you're wrong at all. But cultural humility is saying, despite whether or not this is not evidence-based, I'm real big on evidence-based thinking. I think you
Right.
know that, another discussion, but ultimately, despite the evidence that I might be correct, cultural humility is saying, I literally, despite the evidence, cannot resonate with your experience because I've not lived it. So, despite what my judgment might tell me, or despite what I'm feeling emotionally, it's essential in order for change to happen, for us to proverbially sit on our hands, if you will, and be able to listen to the perspective of our people of color brothers and sisters and find out, like, what is it about this situation that's so triggering for you? Tell me why you would think that, and not try to pass judgment and say, well, here's what I think. Because I think, Kim, that the risk we run when we do that is further alienation and discrediting experiences. And I'm so glad you said that, because I think that's an extremely important concept, cultural humility.
Yeah, I feel like taking notes when you talk, Kevin. I can hear the thing, but I keep taking notes. And I want to tell our listeners that this will live on the Global Wellness Summit Instagram page. So if you want to hear it. Now, we want some nuts and bolts, Kevin, but first of all, tell us as a leader, as you know, an aide through this, what has been your toughest thing to face and what's been your most joyful, the yin and yang?
Good, great question. So I would say the toughest thing that I've had to deal with is pretty consistent with other people Kim have had to deal with, and that is working out the logistics of providing quality care in the midst of a pandemic, right? I think having to think outside the box and be creative in delivery of mental health services, that's something we're supposed to do as psychologists anyway. But ultimately, when you're literally restricted from doing some of the things you ordinarily would do, let me give you a 10-second example. If I'm working with a client, because I specialize in anxiety, who say has OCD, some of the things I might get them to do ordinarily, I can't necessarily do in the midst of a pandemic because it could, in fact, get them infected with the coronavirus. So having to be creative in delivering mental health services via telehealth, right, which is a huge thing right now,
Yeah.
and being able to have the same effectiveness when I'm looking at someone across the screen as opposed to face, that's been one of the biggest challenges, but we've done very well. So I think that ultimately the best thing that's occurred is that we've been able to help more people um, as a result across state lines, being able to be creative, not only with telehealth, but also even with physical distancing. We've been able to still work with some people in person. It's
Oh,
just a matter of keeping our parameters in place. And so we've been really flexible, I
yeah,
guess, which is a word I love,
yeah.
and being able to do that. And we still are able to see people change and navigate COVID, Kim, in a way that you'd be surprised by. Many of the clients I've worked with who struggle with anxiety have not been super concerned about COVID because they learned skills to manage their distress associated with it.
I have a theory that the more scruffy, the more adaptable, and that's your word, flexible, that you've been your whole life really helps during COVID because you just go, okay, well, I'm going to approach it that way then. There's got to be a pony in this room full of poo somewhere, right?
Yep, 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 yep.
So tell us, people come to you for answers all the time, Kevin. You
hmm
are a resource, and that's taxing. That's draining. Where do you go to get recharged? What infuses you?
That's a great question. I several things. Number one, I'm a person of faith, and most people of color are honestly, particularly in the U.S. And I think that that's a very important source of strength for me personally, right?
Yeah.
That I think. Secondly, as you said, I'm an athlete, so ultimately, you better believe, hell or high water, I'm going to find myself working out. So I recharge my battery most certainly through working out and exercise. I do it at home, but ultimately, when we built our home, I said, you know what? I don't want to have to pay a gym membership. So I equipped it that way. And then COVID hit, and I'm like, oh, I'll charge people $2.99 a month. I'm kidding. But the point is I'm able to work out at home. So working out and being fit is really important to me, being a former college athlete in that regard. And then of course, family time. Like, hey, I'm social. I think you know that, Kim. I like being able to watch movies with my two daughters and wife. My two daughters like movies more than she does. But there's that, and then I enjoy board games and hanging out and being able to connect with people in that regard too. So all of those things are a source of support for me. And you combine those, and scheduling that is very important, and not being willy-nilly about it, but making sure that it's a part of my day-to-day routine is super important.
So, Kevin, tell us too. I saw you have two beautiful daughters, and one is
Mhm.
a teen. Are they both teens or no?
Yeah, they both are. One just turned 16 and one's 13.
Ah, so how do you apply? The cobbler's children have no shoes. It's really hard to not have your kids say, "Dad, don't try that on me." What you do with your patients, right? So,
Yeah.
what tips can you give for us to deal with our kiddies through this?
That's good, Kim. And I'll be honest, my daughters have done a pretty phenomenal job of accepting some of the things that I've taught them, primarily because their schools and such like having me there before COVID. And
Right.
I've taught a lot of emotional regulation skills and stuff to the school as a whole. So when their friends are saying, "Oh, your dad talked about that. That's so cool," it's cool to them. So there's that piece. But what I would say, Kim, is what I like to tell parents is that it's super important that we create a safe space to talk about emotions, exclamation point. I think so many times we want to bail our kids out when in reality we're not doing them any service whatsoever if we're trying to prevent them from experiencing anything. Now, it's important to make sure that we are able to not only regulate our own emotions, so modeling emotional regulation, but also giving our children the opportunity to talk about feelings and talk about emotions and normalize things like anxiety, anger from losing sports seasons, anxiety about, well, what's this going to look like with college, right? Sadness about, well, we missed out on all these things. Like, all of that's so incredibly important. So I have to create a safe space to give my kids the opportunity to have that discussion. And that builds your relationship long term when they're adults, right?
Yeah, because it's going to keep everything's going to keep having emotions, right?
Right.
So tell us what TED Talk, book, podcast, besides the Global Wellness Summit podcast, has inspired you during this time. What do you turn to?
Yeah, good. So there's been a few things. I'd say there's a book I've been reading by a gentleman that I've become acquainted with named Billy Epperhart, and he's all about leadership, and he has a book called Leadership Mastery. I really appreciate his perspective with that book, because being not only a psychologist, but being an administrator of a center that I created, it's important that I be a good leader, a leader with integrity, but also a leader who leads by example and breaks bread and spends time with the people that work with me, colleagues and friends. So Leadership Mastery is a really important book I've read. I'm a huge Malcolm Gladwell fan too. So anything that he's written, I've read. So David and Goliath most recently, Tipping Point. You could read
Yeah,
that a million times.
yeah.
Like these are all things that have a psychological facet to them, right, Kim? So naturally, I gravitate to those sorts of things. But yeah, those are the big ones for me right now. But leadership mastery was a big one for me, just because I'm really trying to, step more into leadership role and be comfortable and confident in doing that. And that's a mantle that I have at the moment. So it's important to read up on that.
Well, I
So.
think, people that are following Global Wellness Summit's page, they love the word wellness, right? And I think it's so encouraging, if you want to know what wellness is, to have a doctor like you accessible and as part of a program at a wellness resort like Omrit, which will open in
Hmm.
January, supposedly.
Yep.
That is wellness. Because unless
Hmm.
we do mind body, we're missing, one of the key parts of our being, right?
Yep.
Um, Also, I circled on my notes from your Global Wellness Day interview. Tell us the difference that you found between how men and women handle emotions, Kevin.
Well, I think that because of the way men and women historically have been socialized, I think that men historically have been socialized to internalize some emotions, and some are socially appropriate. Like anger has been one of those emotional experiences that we've been socialized to manifest, which obviously backfires and creates more problems. Whereas historically, women have been socialized to express emotion. There's a huge problem, right? When in reality, there was a piece I think we did. I think it was the Wall Street Journal. I think where it was about anxiety looks different in men, and it was an interview that I conducted with the Wall Street Journal, and then we talked about how the irony, Kim, is there's so much overlap across emotional experiences that if we can teach across gender and such, that there are similar physiological underpinnings across emotions, like particularly for men, understanding that the arousal and anxiety are all very similar, and being able to manage that more effectively and to navigate situations that trigger that are very, very, very important.
The other thing that broke my heart, and in a good way, that I read about you, Dr. Chapman, is that you deal with prisoners that are trying to reemerge into society. Now, that doesn't have anything to do with COVID, but talk about, trial by fire. What have you learned from that? What can you share with us?
Well, I'd say in terms of that, Kim, really more so what I did in that regard is I'm a consultant. I've historically been a consultant for A&E, the TV network, and they consulted with me in one of the media psychology pieces that I did. There was a show called 60 Days In that they conducted, and I was the program psychologist for seasons one and two. So if you go back and watch 60 Days In, you'll see me briefly on seasons one and two. But basically, what I did there is much of what I do now, and that is really helping them make decisions as it relates to navigating a prison experience, navigating the emotions associated with being in a prison setting, finding out like the psychology behind that, what that looks like when you enter a prison setting and when you're released and such. And, ultimately it was for TV in that regard. But again, helping people regulate emotions in a prison setting or in any other setting is really what that was about. So I do some consultation work with some TV networks in that regard too.
And I think if we want to be open minded and realize that we're all human, people that have spent time in prison are human beings too. And they deserve
Absolutely.
all the tools that any of the rest of us do get.
Yep.
So there's so much we could talk about, Dr. Chapman, but in the short time we have left, you and I know your fight an acronym, but let's walk it through letter by letter. What is your toolkit that people can keep in their hip pocket in dealing with anxiety?
Yeah, well, I'd like to say, and ultimately it is potentially going to become a practical book option, but I like to tell people to learn how to fight. And when I say learn how to fight, I think that that's an acronym that I created in the midst of COVID. And fight is an acronym, FIGHT, that stands for the following. F, we need to focus on what we can control. That's very, very important because we can't control how long this will be. We can't control what next season looks like. We can't control what next school year looks like. It's very important that we focus on what we can control. Identifying the identify negative thoughts. So there are thoughts that fuel the fire to strong emotional experiences. And though anxiety and sadness and fear and disgust and anger, etc., are all adaptive emotions, Kim, it's still really important to recognize that we can create emotional experiences right now that may in fact not be trying to tell us anything. So negative thoughts fuel the fire to strong emotional experiences. So when I identify those thoughts, then that's knowing half the battle. Hashtag GI Joe used to say that back in the day. The
But
G,
identify, but you said realize when you're thinking that something could be catastrophic, because maybe
indeed.
it won't be as well, right?
Right, absolutely. Because ultimately, negative thoughts are one thing, but we fall victim to what we call thinking traps. And catastrophizing is one of those thinking traps, as well as what we call overestimation, AKA jumping to conclusions, making these negative predictions about things we can't predict. No human has the ability to do that. So, to your point, Kim, I'm glad you said that. It's identifying those thoughts that are catastrophic in nature and not flexible. So, that's a very important part of the fight. The G, to your point, is generating alternatives. It's not about being positive per se. Positive is important, but it's about being flexible, learning how to generate flexible thoughts. That's the key to emotional regulation, recognizing that generating different thoughts lead to different emotional experiences. The H is highlighting adaptive behavior. What can I do to support those who've been discriminated against? What can I do to engage in exercise or help someone else do that? What can I do to stay in the present moment? Behavior is the high road to emotional regulation because it makes your body do the work for you because it triggers endorphins and it just makes you feel better when you do things that are active. And then finally, my favorite, Kim, of course, is the T, and that is teach someone else the same thing. I'm all about my motto in practice is to teach you to be your own psychologist. So I think it's really important to learn these skills and tools of emotional regulation and then show someone else how to do it. And then they're going to show someone else. And if they show someone else, then we all get better together.
And boy, do we need that, Dr.
Yes,
Chapman.
we
Boy,
do.
boy, do we need that today. So I have learned so much. I've taken my notes. Cultural humility, emotional regulation. Is there a positive message you'd like to leave us with? What hope do you have for the way this will all unfold, Dr.
Yeah.
Chapman?
Well, my thought, Kim, is that the acronym that I just gave you, the reason that that acronym is so important and effective is because not only the decades of research that we've done with cognitive behavioral therapy and emotional regulation and all the work we've done as mental health professionals, I assure you that if you follow these guidelines and follow these principles, if you learn to be more present focused in your emotional awareness, identify the things that trigger strong emotions, learn to not judge emotions, to identify thoughts associated with that, generating more flexible thoughts associated with that. I assure you, I'm in what's called the aftershock business, Kim. In other words, people come to see us and that they have all sorts of impairment, but they always leave smiling, grateful, and their lives are changed forever. You can reprogram your brain and your emotional experiences by not only working through the things we talked about with Kim today, but also by helping someone else do the same thing. It works if you work it. And I know it's so incredibly important to instill that hope. I see it happen every day. And you, basically, you got this. And I know that you can do it.
Well, I have to tell you, if anybody there listening wants to find out what FIGHT stands for, go to drkevinchapman.com, drkevinchapman.com. We're going to look for your book, and we're going to look to keep talking to you, Kevin, because we all need it. And we're sending out, emotional hugs and thanks to you for sharing and making your time. Because if we can't get down to see you, at least you share your thoughts on the media and on vehicles like this. So we can't
I
thank you
appreciate
enough.
it.
Now you
Thank you,
stay
Kim.
strong, okay? Because we need you. So
You do the
stay strong.
same. I
Okay.
will. You do the same.
Okay. See you
Bye,
later.
Kim. Bye.